On this week's edition of Today's Health, an Omaha woman is pregnant and infected with the Zika virus. It is the first case in Nebraska. Reporter Mallory Maddox has more.
The day is getting closer.
Evelyn Swastiggy has a team of doctors guiding her through her high-risk pregnancy here at Methodist Women's Hospital. She is the first person in Nebraska to be pregnant with the Zika virus.
I was frightened, saying I'm the first one to experience this, but so far I've had good news.
Evelyn was on vacation in Mexico when she started feeling ill.
And I had really bad symptoms like fever, body aches, a rash on my legs, and joint pain.
She went to the doctor in Mexico, but it wasn't until she returned home to Omaha that she found out she had Zika. At this point, she also knew she was pregnant.
Yeah, every time I get an ultrasound done, I have like a big worry about hearing bad news because I was sick from Zika.
Evelyn's medical team includes high-risk OB Dr. Hamad Sapathi. Dr. Sapathi says so far, all Evelyn's ultrasounds appear normal. Still,
the one thing we all have to keep in mind that nobody knows how late the Zika could manifest and affect the baby.
Evelyn's team says new findings from the CDC show about 1 in 10 babies born to pregnant women with Zika have Zika-related birth defects. The most severe defect is microcephaly, where the baby's head measures below 30% for the population.
The CDC is recommending ultrasounds for after delivery and then 6 months later, and as Dr. Sapathi mentioned, doing hearing and vision screening on the baby.
With less than a month until delivery, Evelyn says she is following her husband's advice to think positive and hope for the best. They are having a baby girl and will name her Amy.
It's hard to sleep now because I know she could be born any day, and I'm just excited to see her and meet her.
Evelyn's due date is on May 8th. In other health news this morning, a commonly prescribed antibiotic does not increase the risk of abnormal heartbeat. There has been conflicting data about azithromycin, which is often prescribed for bacterial infections. But a new Italian study found the drug was no more likely to cause an irregular heartbeat than amoxicillin, another popular antibiotic. And another new study reveals 3/4 of smokers who tried to kick the habit used more than one method during their most recent attempt. The 3 most common quit methods were cutting back, quitting cold turkey, and switching to e-cigarettes. In fact, e-cigarettes were used more often than the nicotine patch or gum, even though they are not approved by the FDA. New data shows adolescents who take physical education more frequently are more fit and more informed about the health benefits of exercise. Middle schoolers who had regular PE classes were more likely to meet the federal recommendation of an hour of activity a day. However, 1 in 5 students in the study had no physical education at all, and nearly 40% were obese or overweight. Experts say physical education has also been shown to improve students' academic performance. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.